نبدي اليوم إن شاء الله محاضرتنا. It's about 3 infectious diseases: diphtheria, pertussis, and tetanus. We will start with diphtheria. Diphtheria is an infectious disease caused by toxigenic strains of Corynebacterium diphtheria. There are 3 major clinical types of diphtheria. It is either anterior nasal, facial, or it's called also tonsillar, and laryngeal. The bacilli, usually they multiply locally according to the site of infection and mainly in the throat, and they produce a powerful exotoxin. These exotoxins are responsible for the formation of a grayish or yellowish membrane called false membrane. We may see this membrane on the tonsils, pharynx, or larynx, or at the site of implantation. It has well-defined edges, and if we try to remove this membrane, bleeding may occur. We also may see at the area of infection, congestion, edema, and also local tissue destruction. Enlargement of regional lymph nodes also is one of the characteristics of the disease, with signs and symptoms of toxemia. The fatality rate of diphtheria in untreated cases may reach up to 10%. Among treated cases, it reaches up to 5%. The disease is rare in developed countries because of high coverage of immunization in these countries, especially for children, of course. And in developing countries, it continues to be endemic. It occurs at low levels or low rates in many developing countries throughout the year. The true number of diphtheria cases and deaths are not known exactly because diphtheria characterized by many carrier states. So these are not cannot be well recognized. So subclinical cases cannot be detected easily. That's why the true number cannot be estimated exactly. One important thing regarding diphtheria, the improved socioeconomic conditions all over the world changed the epidemiology of this disease. And this led to less opportunity to maintain natural immunity, especially through cutaneous transmission of disease in the type of cutaneous diphtheria, which is more common in developing countries, especially in African countries. So due to this lifestyle and socioeconomic conditions, outbreaks had happened or reported in different areas of the world, like in Ukraine in 1990 and in Thailand in 1996. Regarding epidemiological determinants, the causative agent of diphtheria is Corynebacterium diphtheria, which is a gram-positive non-motile organism. There are 3 different types of this organism: gravis, mitis, and intermedius. This classification is according to the severity of the infection. So the most severe type of diphtheria is caused by gravis, and the mild form called by mitis. They are all pathogenic to man, but not all toxigenic, or not all produce exotoxins. And the toxin of this microorganism can reach the heart, leading to myocarditis, or to the nerves, causing neuropathy or neuritis, and then paralysis. Diphtheria bacilli are sensitive to penicillin, and they can also be killed by chemicals and heat. The source of infection of the disease could be a case or a carrier. Cases, there is a wide range of clinical spectrum of the disease, ranged from frank clinical cases to subclinical, and also, as we said, a carrier state is common. Its rate from 0.1 to 5%. Of course, it is transmitted by nasopharyngeal secretions. Also, in the type of cutaneous diphtheria, discharge from skin lesions is also infective. Contaminated fomites, utensils, articles, and there is a possibility of transmission through infected dust also. A period of infectivity of the disease, if untreated cases, the disease can be transmitted for as long as 14 to 28 days from the onset of the disease. Carriers may remain infective for much longer periods. Because, as we said, carriers may not be detected and may not be treated, so they remain as a source of infection. The disease usually affects children between 1 to 5 years, equally for both males and females. Immunity, infants, they have immunity from their mothers through maternal antibodies in the first 6 months of life. Of course, as we said, in developing countries, as we said, because of low coverage of immunization, lower usually age groups affected, and may not all have immunity because of low coverage of with immunization or vaccination. Regarding environmental factors, of course, it occurs throughout the year in all the seasons, but mainly in winter due to overcrowding in this part because of the cold weather in this part of or in the season of the year. It can be transmitted by droplet or directly through cutaneous lesions or through contaminated objects, which is contaminated by secretions of the case. Portal of entry through respiratory route by droplet, and there is also non-respiratory routes. These are non-respiratory are less common in developed countries. Respiratory route is mainly the source or the portal of entry in developed countries. Incubation period ranges from 2 to 6 days. It may be longer. Regarding control of diphtheria, of course, the important thing is early detection of both cases and carriers. So active search for cases and carriers by cultural methods. Of course, all cases, suspected cases, carriers, all should be isolated for at least 14 days or until proved free of infection. يعني نسوي لهم المفروض 2 cultures 24 hours apart, both should be negative, and then to end isolation. Regarding the treatment, of course, the treatment is by diphtheria antitoxin and antibiotics. Diphtheria antitoxin is given either intramuscularly or intravenously. The dose range from 1,000 to 80,000 international units, depending on the severity of the case. Penicillin or erythromycin can be given to cases for 5 to 6 days. For carriers, usually 10-day course of oral erythromycin is given. All contacts should be throat swabbed for culture, and also their immunity status should be determined. So if those contacts who are exposed to a case of diphtheria have a previous immunization, primary course or booster dose within the previous 2 years, so no further action is taken. But if they have had the primary course of immunization or booster dose for more than 2 years before, so they should have a booster dose of diphtheria toxoid. The non-immunized close contacts should be given a prophylactic penicillin or erythromycin, and also 1,000 to 2,000 units of diphtheria antitoxins, and also after that they should have also active immunization with the diphtheria vaccine. Of course, medical surveillance that is examining daily for a week after exposure for any evidence of the disease. Bacteriological surveillance also to have swab for every week for several weeks of also after exposure. So we have 2 types of surveillance or looking for the disease among contacts, either medical or bacteriological. Regarding control of disease among the community, active immunization of all infants as scheduled in the program of immunization, and then a booster dose is given every 10 years because of waning of immunity. And we should know that immunization does not prevent the carrier state because, you know, the vaccine is toxoid. So infection may still occur. So we may find carriers in spite of immunization in any community. Diphtheria immunization, we have the combined vaccine that we have in our country. It is given to all children, which is DPT vaccine. It should be stored from 4 to 8 degrees centigrade. Regarding age, doses, mode of transmission, sorry. Just a minute. Okay. Okay, so the vaccine is usually given at 2, 4, and 6 months of age, and then it is given also at 15 or 18 months of age, and then at school entry or preschool at 4 to 6 age. Of course, انتوا السكيدجول كله تاخذوه ضمن محاضرة expanded program of immunization. Regarding reactions, there may be neurological reactions like encephalitis, encephalopathy, prolonged convulsions, infantile spasm, and Ray's syndrome. Children who are more than 5 years of age and not received DPT before, they should have 2 doses of DT, yani only diphtheria and tetanus without pertussis at 4 weeks apart, and a booster dose to be given 6 months to 1 year later. For those over 12 years and adults, 2 doses of DT. هنا لما نشوف ال D small means lower concentration than the previous vaccine. This is given at 4 to 6 weeks interval with a booster dose at 6 to 12 months after the second dose. Anti-sera for diphtheria antitoxin, we talked about it as an important in the treatment of the disease. It is also given as passive prophylaxis in addition to treatment, as we said before. The second infectious disease is pertussis or whooping cough. It is also an acute infectious disease, usually of young children, caused by Bordetella pertussis. It is clinically characterized by catarrhal symptoms with mild fever, and it gradually develop to have irritating cough, and then the paroxysms of cough. That's why it's called whooping cough. It ranges the spectrum of disease from severe to mild illness without whoop. It is a clinically serious illness with high mortality and complication rates. And it occurs worldwide as endemics. It's also present endemic all over the years with low number of cases, lower acceptable rate, or it may occur as epidemics or outbreaks. Of course, it is mainly in Asian or African countries. Infants and young children who have not been immunized are much at risk of this disease because regarding pertussis, the infant does not have maternal antibodies or does not have immunity from the mother. Epidemiological determinants of the disease: the causative agent is Bordetella pertussis, and the source of infection, usually a case of pertussis, may be mild case or subclinical unrecognized cases, because as we said, the spectrum of the disease is, there's a wide range, maybe only mild disease without the characteristic paroxysms of cough. Infective material is nasopharyngeal and bronchial secretions. Also, objects freshly contaminated by such secretions can be a source of infection. The infective period from a week after exposure to 3 weeks after onset of paroxysmal stage, but the highest or the main period of infectivity is the catarrhal stage of the disease, before the main symptoms appear. Regarding host factors, it usually affects infants and preschool children. So the highest incidence below the age of 5 years, and the highest mortality rate is among infants below 6 months of age, because they don't have immunity from their mothers as other infectious diseases. And it has been found that female children are more affected by this disease than males. Children will have immunity after recovery from whooping cough or after adequate immunization. Second attacks may occur, but usually mild, and infants, as we said, are susceptible to infection from birth. That's why we give the DTP vaccine. The triple vaccine is given early in life because of pertussis. The child not have immunity or maternal antibodies for this disease. Of course, it is mainly, as other diseases, infectious diseases transmitted through respiratory route. It occurs mainly during winter and spring months, especially in lower socioeconomic areas, because of overcrowding in these areas, especially in the cold seasons of the year. The mode of transmission is by droplet infection or by direct contact. Incubation period of this disease is from 7 to 14 days, but not more than 3 weeks. Clinically, the course of the disease, as we said, start with the catarrhal stage as mild respiratory symptoms for 10 days, followed by the paroxysmal stage of the cough from 2 to 4 weeks, Then convalescent stage from 1 to 2 weeks. So generally it lasts from 6 to 8 weeks. Complications of this disease, bronchitis, mainly respiratory bronchitis, bronchopneumonia, and bronchiectasis. Also, other complications may occur due to the violence of the cough. The child may have subconjunctival hemorrhage, epistaxis, hemoptysis, and cerebral hemorrhage, and may lead to coma or death. Regarding control, cases and contacts. Of course, the most important is early diagnosis of cases, and they should be isolated and treated. Isolation until they become non-infectious. The drug of choice is erythromycin, and alternatives to this drug are ampicillin, Ciptran, or tetracycline. Regarding contacts, of course, prophylactic antibiotics is given, like erythromycin or ampicillin for 10 days. And also for non-immunized children, active immunization with DPT is provided. Contraindications to pertussis vaccine are personal or strong family history of epilepsy or convulsions, any febrile upset until fully recovered, a reaction to one of the previously given triple vaccine injections. The last infectious disease is tetanus. It is an acute disease induced by the exotoxin of Clostridium tetani, clinically characterized by muscular rigidity, painful paroxysmal spasms of the voluntary muscles. The disease is it is almost eradicated in developed countries, so it is very rare there. The important type of this disease is neonatal tetanus, because it is a killer disease for infants. It is second only to measles among the 6 target diseases of the expanded program of immunization. And even with the treatment of this disease, the case fatality reach up to 80 to 90%. And it tends to occur in areas with poor access to health care. So in developed countries, this has been eradicated by only preventive measures with hygienic measures to be done or used during labor or delivery of the babies. Epidemiological determinants, agent factor, Clostridia tetani, which is a gram-positive anaerobic spore-bearing organism. It has a potent exotoxin called tetanospasmin. The reservoir of infection, the microorganism, the bacilli, are found in the intestine of herbivorous animals like cattle, cows, sheep, horses, and these are excreted in their feces, and leading to formation of spores, which remain in the environment, and by this process, infection can be transmitted to human being. So the disease is transmitted mainly from animals to human beings. That's why when you asked about period of communicability, there is no period of communicability because there is no man-to-man transmission of the disease. Regarding host factors, usually tetanus affects all those at active age from 5 up to 40 years of age. And regarding the newborn also, as we said, neonatal tetanus Infants typically contact the disease at birth, and during birth, due to non-hygienic practices that used during delivery of the fetus, the infection may occur. أيضا there are many bad practices used, especially in low socio-economic areas. يعني يخلون فد مواد معينة على الأمبلايكس أو using يعني الكاتنج، خصوصا الآلة اللي تستخدم أيضا بالcutting of the cord is contaminated, and that by this means infection or neonatal tetanus can occur. Males have a higher incidence of the disease because, you know, males are more and they work, for example, in farms, in many areas, and they may be in contact with the spores more than females. But females are more exposed to the risk of tetanus, especially during delivery or of the baby, leading to puerperal tetanus. Regarding occupation, also it is very much related to the occupation of the person, especially agricultural workers who live near in the area where animals is prevalent, in agricultural areas. So there is rural-urban differences. It is more, of course, in rural areas. Regarding immunity, 2 injections of tetanus toxoid highly effective, gives highly effective immunity, lasts for several years. Usually, the mode of transmission is through contamination of wounds with tetanus spores that are present موجودة يعني wherever you go in the streets, especially as we said in rural areas. Incubation period usually from 6 to 10 days and maybe as short as 1 day or as long as several months. Prevention is by active immunization with tetanus toxoid, and also there is the combined vaccine DTP اللي هو هذا يعني vaccine اللي يعطى for these 3 diseases, diphtheria, pertussis, and tetanus, given intramuscularly, as we said, in 5 doses at 2, 4, 6 months, مثل ما قلنا بعدين at 15 to 18 months, and at 4 or 6 years of age. The other is TDAP. This is with lower concentration of diphtheria and pertussis. 1 dose is given intramuscularly at the age of 11 to 12 years. And then the following boosters given every 10 years هي تكون فقط TD. All persons should have received a primary immunization series and should receive booster doses of tetanus, diphtheria combined toxoid every 10 years, as we said. Regarding passive immunization, hyperimmunoglobulins giving temporary protection from the disease. The dose is usually 250 to 500 international units. The protection is usually for 30 days or more. Yani when a person exposed to, he is at risk of tetanus, we give immunoglobulin, give the person protection for up to 30 days. Regarding prophylaxis of wounds, of course, careful assessment of wound. We should also assess the immunization status of the person. Also the use of the, according to the use of tetanus toxoid or immunoglobulin. Also, we should be aware of the careful cleaning of the wound and using antibiotics. This table is a guide for tetanus prophylaxis in wound management. Here, we depend on history of tetanus immunization and also the type of the wound, the clean wound, minor wound, or it is other wounds which is contaminated, or more severe wounds. And also depending on the doses of immunization, if we are uncertain or less than 3 doses, or if the person has 3 or more doses. So accordingly, we are going to provide the tetanus prophylaxis for that person after exposure to the disease. Regarding antibiotics, a single intramuscular injection of long-acting penicillin usually is used, which is benzathine penicillin. Also, a 7-day course of erythromycin is given. Antibiotics should be given as soon as possible after an injury, which may be as soon as 6 hours after injury, especially in high-risk areas where the person with wound is at a high risk of having tetanus. Regarding neonatal tetanus, as we said, in industrialized developed countries, it is well controlled through clean delivery practices alone. While in developing countries, it is still, as we said, there is still a high risk of this disease. So many measures should be taken in consideration in these developing countries by training of traditional birth attendants, يعني القابلات الأهليات which اللي يعتمدون عليهم خصوصا بالrural areas. They should be trained, and also home delivery kits اللي هي كلها معقمة should be provided for those birth attendants. And also they should have educated all pregnant women, all those attending birth, fetus birth, should have educated about 3 cleans, clean hands, clean surface, and clean cord cuts. In areas where the incidence of neonatal tetanus is high, the primary 2-dose course can be extended to all women of childbearing age. يعني ممكن تعطى يعني هو التيتانس توكسويد for females يعني at schools عادة ينطون مثلا في صف 5 ابتدائي، في ثاني متوسط. Also tetanus toxoid is given during a pregnancy in our country as part of antenatal care. يعطى عادة at 4th and 5th months of pregnancy. هاي يعني during a pregnancy. بعدين طبعا ال further doses be given عادة 5 doses for non-immune mothers to have يعني to be immune for life. Infants born to non-immune mothers are exposed to the risk of tetanus, so injection of antitoxin within 6 hours of birth is important. Thank you.